Morning, welcome back. Well, a certain type of weight loss surgery is having a troubling effect when it comes to opioid use. And joining us this morning to talk a little bit about the problem, Afton Koball from Gundersen Health System, to talk about the link between opioid use post-op and bariatric surgery. Afton, thanks for joining us.
Good morning. Thanks for having me.
So why are we seeing this with bariatric surgery specifically at such a higher rate?
Well, what I first want to emphasize is that this study really highlights what we're seeing across the country. We know that opioids are a problem nationwide. We know that late last year, the opioid crisis was declared a national public health emergency. And so what we see with bariatric surgery in some ways mirrors that. We know that it can be a problem for folks. What this study really highlights is that people who have bariatric surgery are at higher risk of having problems with opioids post-surgery. So people who are not using opioids post-surgery, about 1 in 12 report that they're using it about a year after surgery. And people who were using opioids pre-surgery, about 1 in 4 continue to use a year after surgery. And this is about 45% higher than averages for people who have other types of surgeries, not bariatric surgery.
Interesting. So do they know specifically why it's this surgery? Is that a correlation that having this surgery specifically causes them to continue the opioid use after?
Sure, there are a couple possible explanations. We're not exactly sure. We need to do more research in this area. But what we're thinking is that one of the main contributors is that people who have gastric bypass surgery specifically, they have changes in their bioavailability of medications and nutrients post-surgery. So potentially opiates could affect them more strongly post-surgery, lead to more sorts of problems for them.
Now, you mentioned it being a trend, of course, with the opioid grabbing national headlines. Of course, we're talking a lot about it. Do you think we're going to see more studies like this as we go forward now?
Absolutely. I think that this is a really hot area of research. I think that medical organizations, especially like we here at Gundersen, are interested in learning more about the mechanisms of why people struggle with opiate use. Our bariatric surgery team here as well is actually doing a study in this area right now, wanting to learn more about how people with chronic pain tend to do after surgery, and certainly looking at how opiates factor into that is a really important piece of our work as well.
All right, Afton, that is all the time we have this morning. Thanks so much for joining us.
Thank you.